Good afternoon, North Dakota, and thank you for joining us on this COVID press briefing. Joining me today for later on for questions will be Chris Jones, the DHS Executive Director. The place we want to start today is there's a lot's happened since we just met on Thursday. On Thursday, Chris actually was here speaking, and the focus on Thursday was talking about the rise in COVID-related hospitalizations in our state, and the need for everyone to do their part to help slow the spread and reduce the pressure on our healthcare system and on our valiant and hardworking healthcare workers that are on the front lines, both in long-term care and in clinical and in inpatient situations. Since that time on Thursday, we've had multiple individual and group discussions with key hospital leaders across the state, but we've also watched just in the last few days our hospitalizations due to COVID rise by another 10% to 254. And that's 60% higher than just 4 weeks ago when we had 158 individuals hospitalized due to COVID. We also have seen over the weekend record days, Friday, Saturday, Sunday, and today really strong new active cases. And just to put this in perspective, going all the way back to last spring, we talked about that when you have a disease that's highly infectious and it's transmitted human to human, if we have these transmissible moments, whether those are in large group settings or casual family settings where one individual might be asymptomatic, meaning they don't know that they even have symptoms, but they could be highly transmissible, then one can affect many, and then you end up with this exponential growth. So in North Dakota, we had our first case on March 11th. It took us over 200 days, over 7 months, to October 19th to get to 5,000 active cases. October 19th seems like just a few weeks ago. It was under 3 weeks ago. And now today we've crossed over this weekend 10,000 cases. So it took us 7 months to get to 5,000. And it took us 3 weeks to get over 10,000. And you might say, oh, well, did you get there with more testing? Well, our testing is up slightly from mid-October, October 19th till now, from about an average of about 7,300 to about 8,800. But our positivity rate has gone from 9.3 to almost 15 on a 14-day trailing. It's higher than that on the 7-day, with some individual days getting closer to 20%. So again, it's more prevalence, more community spread, and that's what's causing this accelerating capacity. And while we have had some great gains in terms of hospital productivity, we'll talk about that, the confluence of more cases and cases of people that are elderly is going to continue to put enormous pressure. And so today, we've moved this press conference up today in part because we know that we could be facing a situation in our state in the next 2 to 3 weeks where we would be severely constrained on hospital capacity. Some parts of the state we're already seeing that last week, but we are wanting to make sure that, again, we get everybody on the field that can be part of the solution. We do know that throughout this pandemic, there's been enormous debate, and some of that debate and opinions has been I would say politicized. So whether it's masks, their efficacy or not, mask mandates, whether they work or not, how deaths are reported, state to state, et cetera. There is every aspect of this. Vaccines has been also debated, and I'm sure will be debated going forward. So everything's been debated, and there are lots of opinions and lots of thoughts, strong thoughts on each side of those. But there's one thing that here in North Dakota, we can eliminate all the debates and just look at hard data, which we said that we would. And there's one thing that's not debatable, and our discussions with hospital leaders this last week have confirmed it, which is our hospitals are under enormous pressure now, and the current rates of growth in COVID active cases, which then active cases come first, then hospitalizations come later, and in some cases, unfortunately, if that's followed by an increase in the death rate, then we see that where we are right now, we can see the future 2-3 weeks out, and we know that we've got severe constraints. And again, If you're not a believer in COVID, we know that there are some people in North Dakota that don't think that too much emphasis has been put on this. Hopefully that you'll understand that other things actually are real. Heart disease is real. Diabetes is real, cancer is real, stroke is real, trauma related, whether it's car accidents or just an elderly person falling, all those things are real. And it's the reason why we are so fortunate in North Dakota and in our country to have such a strong healthcare system. We count on that to be there. And of course, right now, today, about 86% of our hospital capacity is being used by non-COVID related. And that we get to that number because if we take the 254 hospitalizations that we have, and those are people that were admitted due to COVID. Once someone is in the hospital, say if you come in with a stroke, you come in because you're admitted because of a heart condition, hospitals are testing people upon entry. We have additional folks, 383 total, that are in the hospital that are with COVID. 254 were admitted due to COVID. But if you take that 383 number right now, that's right up at about 20% of the hospital capacity in the state is going towards COVID, people either due to COVID or with COVID, the other 80% for the non. And so when we ask people to participate in mitigation efforts to reduce hospital capacity, you don't have to believe in COVID. You don't have to believe in a certain political party or not. You don't have to believe whether masks work or not. You can just do it because you know that there's one thing that's very real, and that's that 100% of our capacity is now being used, 80% by non-COVID, 20% by people either due to or with COVID, and you can make a difference. And you can make a difference in preserving that capacity, in whether it's for your a family member and somebody who's elder, but it might be you in December or January. If you have a stroke or have some unexpected need for a high level of care, you're preserving that for everybody and possibly even yourself. Now, how did we end up with this capacity constraint? Well, from the hospital standpoint, it's not for lack of effort. And it's not for lack of effort either from the state or the federal. The federal government has poured billions of dollars into supporting our hospitals. The state of North Dakota has diverted funds through the coronavirus relief funds and others to help support our hospitals and their staffing concerns. But we right now have hospitals that are paying traveling nurses. In some cases, there's hundreds and hundreds of traveling nurses that are working here in North Dakota, and those traveling nurses are hired through an agency. Our hospitals have to pay those agencies sometimes exorbitant amounts of dollars. In the case of just one hospital, they're spending more than hundreds of thousands of dollars a day to bolster their staffing levels. So some of our hospitals will be in the coming weeks suspending elective surgeries on their own volition, and they'll keep those if the situation is super urgent or emergent, but the others are starting to initiate their surge plans. We are also, in our effort to formalize our collaboration between our hospital leaders in the state of North Dakota in an effort to provide the best capability for all citizens. Chris Jones and his team has initiated today what will be the first of daily stand-up meetings, and stand-up is a term that some people may be familiar with in terms of a management tool for having quick operational sync-up meetings on a daily basis. We'll do this with our major healthcare systems in North Dakota, and that'll include Sanford Health and Essentia in Fargo, Sanford and CHI, Lexus Health in Bismarck, Trinity Health in Minot, and Altru in Grand Forks. Participating from those hospital organizations are 6 majors that are the referral hospitals that receive a lot of inbound cases that come from our rural critical access hospitals. We'll have the chief operating officers and chief nursing officers there. There'll be times when the CEOs may sit in on these, or the presidents of those markets, and then other leaders from the state, including our leaders of the Unified Command and the Health Department, in addition to Chris Jones. I had an opportunity on Friday, along with Chris, to be on a call with the leaders from all of these groups when we made the ask, and I want to say thank you to all of those hospital organizations for agreeing to do this, because these are in some cases, people that compete with against each other, but everybody in all of these organizations, I can assure you, has in mind what's best for North Dakotans. And again, we want to, by sharing and understanding where the capacity is, and it's not about beds, it's really about staffing. How can these organizations even help each other out? If we've got staff available in one market, can we move them to another? Can we move them across what might normally be seen as competitors? How can we work to have effective surge plans, if we will, to optimize the capacity that we have in our state and still be providing that care within the hospital walls of our primary hospitals. We also need our rural hospitals to participate, because in some cases our surge plans may include step-down transfers for people out of the major hospitals back to what might be closer to home. If they need a lesser degree of care, but it can be provided closer to home, we can move people that are recovering to our rural hospitals. And so again, whether it's a COVID-19, a heart attack, stroke, surgery, the flu, or other illness or condition, we are going to continue to work to make sure that we've got the optimal and maximum amount of both COVID and non-COVID capacity available in our state. But to do that, there's some things that we can do to help out on this, and one of those is for us to as North Dakotans to work to help slow the spread and lessen the burden. And again, as we say, we're working on this. But let's just take a look at some numbers here that we have here. Patients that are coming in to the hospitals due to COVID. You see this number has continued to climb on a pretty steady rate, but you might say to yourself, well, that's not climbing quite as fast as our infections are. That's because the hospitals have gotten better at treating people. But let's take another look at another slide. This one is something also we're going to be watching closely. These are active cases over age 65. And we know that hospitalizations are tilted towards those that are in the plus 60, plus 70, plus 80 category in terms of people that have more severe cases and that can require hospitalization. So as we watch our active cases grow, we're going to keep an eye on these age groups, because this can be a leading indicator of our need for hospitalization. On the next slide, when we talk about, sort of increased productivity here, and this reflects the trends nationally. The blue line on here is average length of stay. We reported that we had been able to get that down to 7.5 days. In September, that's dropped even again in October, which is fantastic that that's gone down. And then also the percentage of the total cases in the state that require hospitalization are going down, but that's a reflection really of our strong testing program and identifying and getting out of circulation those asymptomatic positive spreaders that don't require hospitalization but can infect people that do. And so that's why it's positive to see that red line going down. But when we have when we talk about the hospital, people that are hospitalized, and Chris touched on this last Thursday, is that our hospitals have always been managing capacity and staffing. Normally during flu season, the hospital capacity in North Dakota would be slightly larger during the winter months than it would be in the summer months, because they would flex up based on that demand. And they are in the process now of trying to flex up. But as we have other things that have caused us to lose healthcare workers, and that's because healthcare workers can get exposed and they themselves can become a positive case, or they could be in a situation for quarantine, et cetera, because of close contact. So today we took a step to help address the staffing issue with an amended state health officer order that now is going to allow asymptomatic COVID-positive healthcare workers to work in COVID units of licensed healthcare facilities, so long as they remain asymptomatic, and additional precautions are taken as recommended by the CDC and the North Dakota Department of Health to protect both the worker and the patients in that unit. This is something that the CDC has allowed for a period of time. North Dakota's health orders were actually more restrictive than the CDC, so we're moving those to come in line with the CDC, which again will free up some of those asymptomatic healthcare workers are going to be able to go back to work in COVID units. And again, this applies only to COVID-positive healthcare workers who do not have symptoms, and they are allowed only to work in COVID units around patients who already have the virus. So that's one step that we're doing. We also know that there is an opportunity because when a healthcare worker is tested and their test gets sent away, it could be 24 to 48 hours before they get a response to find out if they're positive or negative. Meanwhile, while they're in that waiting period, they're effectively on the sideline. And we know that while some of those do come back positive, the majority come back negative. The person can then go back to work because they're negative. If we could have given them that result in 15 minutes instead of 2 days, that frees up, in some cases, for some hospital, dozens of people that are sort of perpetually, it rotates who they are, but as people get exposed, they get tested, they wait for the results. We've got a portion of healthcare workers that are on the sidelines waiting for test results. So working with the state health department in our unified command, we're going to begin shifting rapid testing towards healthcare workers to help our hospitals and inpatient providers to get those people back on the playing field, so to speak. And as we do lead the nation in per capita testing, as we've mentioned in other briefings, we've done that really all through the PCR, or the lab-based. We're also beginning to roll out our rapid testing. And this week, we're going to be using these tests now and across a number of pilots. Some of those include the following. We're sending 3,500 Binax Now tests to UND, 1,200 to NDSU. Minot State will receive 200, and in Dakota College Botno, we'll get 250. These will be used to test staff and students, including student athletes. And while these numbers are smaller, those groups will work out their testing systems and their reporting systems, and then we can expand on top of those more quickly. The 1,200 tests per week are being delivered to local public health, 1,500 each for the 8 public health, and they can be used for testing first responders, healthcare workers, staff, and whoever else, and they deem, who they deem appropriate. We're also wrapping up a pilot project to test staff in the Bismarck School District, and that'll now expand to districts with counties that have higher positivity rates and other active populations. And again, as I said, we're also going to be using the Binax Now to help get workers back in the game sooner if they were named as a close contact and need to get tested at our healthcare. We'll continue to do the testing that we're doing, long-term care staff that we've been doing. We've been doing that weekly. In some cases with Binax, we'll be able to use a combination of PCR and Binax and now test them twice a week. Continue to work with our tribal partners. And with Binax Now, the first one of those is going to start in about 10 days, November 20th, with a pilot at MHA, and we hope to test about 2,000 people on a recurring basis. We've been shipped about 150 Binax Now that are here, and we've been assured a total of 220,000 by year end. It's key that we get going on using these Binax Now because they do track at the federal level whether they're being utilized or not. So again, our local public health units, if you're getting 12,000 a week, if these are kept in inventory and not used, then the federal government will ship us less. If we use them to help in these strategic ways, we can get more. So the key for us is to follow through with the pilot programs that we've got in place right now. Again, another arsenal in our tool, but this is particularly important for us to help get healthcare workers and keep them in the game at a time when healthcare workers is the key constraint in our ability to provide care for everyone. The next topic is how we're going to be expanding support from EMS personnel. And we know that since the beginning of the pandemic, ambulance services and EMS have played a critical role on the front lines of our response for caring for the health of North Dakotans. In some cases, they've provided invaluable support for testing efforts, including helping with site management and data collection and swab collection. And the support of these EMS personnel has proved so effective. And of course, they're doing this on top of all the other calls that they have to provide emergency care across our large and rural state, that we are now planning to expand EMS participation in all areas. And one way that we're going to do that is to do some direct engagement. So the North Dakota Department of Health will be hiring EMTs, advanced EMTs, and paramedics for testing missions throughout the state on a full-time or part-time basis. And the pay for these roles will be based on licensure level, but currently the hourly wage will be about 30 for EMTs and 42 for paramedics. The point of doing all this is, of course, to utilize the great EMS talent we have, but this can also free up some of the nurses that we have working for Department of Health to be deployed to support inpatient care as needed, because the EMS folks are in a great position to help with help particularly with these testing strategies. So if you're interested in applying, health.nd.gov/careers, select the COVID response medical team or call 701-355-6823. When we take a look at the numbers that we're watching, which, let me forward that. I'm going to go to one more thing before I go to that. Is really talking about, again, sort of the summary of this whole section, because if there's a concern that we're constrained and based on numbers running out of healthcare capacity, what are we doing about that? One, with the daily stand-ups, coordinating the entire system to optimize the system. Two, changing the state health officer order that allows those that are positive to work in COVID units. Three, getting the testing going to help get people, testing personnel, back on the playing field. And four, getting our EMS involved statewide in test collecting so we can free up nurses to support our healthcare. So those are all steps that are being taken right now to help us maintain and expand healthcare capacity. And again, we thank our partners, the major hospitals and all of our rural hospitals for their collaboration on this. But what we need from everybody else is if you can do a couple things. One is it's important that you continue to seek your regular routine outpatient care, because if you take care of yourself and take care of your health and don't skip appointments, take your medications, you can avoid emergency services that might emerge in the future. And then, of course, the public health protocols, which we've talked about consistently now going on almost 8 months, which is, again, encouraging people to use face coverings when you're unable to physically distance. Because that's the most surefire way. If you stay away from other people, it's a surefire way to stay away from getting this disease. And hand hygiene, of course, is super helpful. And talk about getting your flu shot in a second. And again, avoid and eliminate opportunities for maskless crowding and limit all private social gatherings to immediate household. And we say that as we head into Thanksgiving time period, because now about 2 weeks out from Thanksgiving would be a good time, if you will, as they say that younger folks, form your pod, get your group of people that you know are practicing the face coverings and social distancing at all times. And within that group, keep yourself healthy. And that's the group that you should start working with now to make sure that for the 2 weeks prior to Thanksgiving, if you're going to get together in Thanksgiving, that's a good way to make sure that you're protecting any family members that might be elderly or vulnerable that you're planning on seeing by being extra smart in these days leading up to the holidays. And again, if you're not comfortable or for whatever reason, for health reasons, can't wear a mask, you have a choice to always just stay further away from other people. That's an easy personal responsibility to do, to make sure that you're not part of this chain of contagion that is pouring through in our state. And then also getting your flu shot. We've talked about this before, but we did have 2,000 cases of flu last year, resulting in 426 deaths. And again, that is a number that goes up and down every year, and 549 hospitalizations related to that. If we want to take pressure off of our hospitalizations, everybody can get their flu shot. It's available now. In most cases, it's free, and you can go to vaccinefinder.org or the North Dakota Health Department, and you can find out where and how you can can get your flu shot here in North Dakota. When we take a look at the numbers that we have right now, what we're watching, as I talked about at the beginning, which is we're now have blown through the 10,000 up to 10,865 active cases, and from a 7-day rate, our highest 7-day positivity rate at 16.3. We talked extensively about the 254 people that are hospitalized, and those are people that are hospitalized due to COVID. 383 people are hospitalized with COVID. But all of those numbers are occurring within this national and international fall resurgence. We said last spring there would be a second wave in the fall. That second wave is hitting the upper Midwest, the sort of Great Lakes to Rockies, sort of hardest and first in terms of the number of cases. And this is, again, has been discussed as people move inside in areas with lower humidity and perhaps less positive air circulation and close contact and unmasked. These can create highly transmissible moments compared to doing the same activity, say like dining or something outside in the summertime when we move indoors. And so we're seeing this here where we've got, starting with Illinois, Wisconsin, Minnesota, Missouri, Iowa, where there's a tremendous amount of cases that are there, Colorado, Nevada, all of these that are on the rise around the country. And really we're seeing, I think, in close to 40 states where they're seeing COVID cases rising right now as we head into winter. When we take a look at the test positivity for that region, we can see that while North Dakota's at a new record, we're still faring better on positivity than neighbors to the south and southwest of us, where we're seeing record high positivity rates in some other states. And again, but what really matters, again, for North Dakotans is that we've got the ability to care for them when they need it, and that gets back to hospital capacity, which is the focus of today's presentation. When we take a look at the trailing 14-day rolling rate, we're at 14.8. Again, the trailing 14 is lower than our trailing 7-day because we're on the rise right now. That'll be the opposite when we're on the way down. But you can see, again, we haven't seen the spike up to the 30, 40, 50% positive like some other states have. So thank you, North Dakotans, for everyone who's been doing their part to help slow the spread. But we are still headed in the wrong direction and still continuing to climb upwards. And we want to see that flatten out, plateau, so we can get it going down. On the active cases, again, when we pull up this slide that shows where the active cases are around the state, the darker the color, the more cases. So now we've got 4 counties that have more than 1,000 cases. So Grand Forks, Ward, Burley, and Cass, and we throw in Morton in there as part of the Bismarck-Mandan metro area, really combined. What we also notice is, when I mentioned earlier, the 6 hospital providers that we were talking about occupy and reside in those 4 counties. And so the idea that we have hospital capacity availability, and the reason why we're all in this as a whole state is that the smaller regions of the state have to refer their patients oftentimes to these larger areas, and the larger areas are now getting inundated by cases in their own right. Earlier on in this battle against COVID, we started out last spring when most of the cases and the majority of the deaths were occurring in Cass County. There might have been some thought that, hey, that's something that happens in the big city, quote, like Fargo, West Fargo, Moorhead metro area, not going to affect us. We don't need to worry about it. Well, then it sort of died down a little bit in the eastern part of the state, and then it came stronger in the Burley-Morton area. Grand Forks was very low for a long time, but popped up when the university students came back in. Minot escaped heavy numbers until more recently, and now they've been inundated. But now we're not fighting a one front battle, either in Cass or Burley. We have all of our major metros with record cases and increasing cases. And of course, this creates risk for all of the outlying areas as well, because people travel to these areas to shop, they travel there for medical care, and if their loved one needs to be hospitalized, that's where they end up eventually being transferred to. And so this again sort of highlights the importance for all of us to be acting together, and there isn't really a spot in the state that's unaffected by the level of community spread that we have right now. When we take a look at active case rates, divide by population, we can see that well, we've got large population areas like Cass. Those are with a lot of absolute cases. They're not actually the highest concentration. Right now, Walsh County, and again, we had Walsh and Cavalier and Pembina, Nelson, and others. Those were places that often, throughout the first 6 months of this, had very few cases at all. Now we're in a situation in Walsh County where it could be the highest we've seen so far. I think nearly 4% of the county is currently an active case. And so that again puts pressure not just on Walsh or a hospital in Grafton, but it puts pressure on Grand Forks Hospital and Fargo hospitals with transfers. So again, point here is that we're all in this together. When we take a look at the North Dakota SMART guidance, which we've been sharing in the past, we'll take a look at where we positioned the state just last Thursday. We had a majority of the state population was in the high risk category, and some were still in that yellow or moderate risk category. Today, we're announcing that we're moving all remaining counties from yellow to orange. This would indicate the seriousness of the situation, where the whole state is at high risk, and this means that all 53 counties are under the guidelines of the North Dakota SMART Restart. In those guidelines, it talks about all, by different business categories, whether it's personal care, whether it's hospitality. So we refer people online to all the specifics that are there. But it also it means that businesses, events and gatherings should reduce occupancy to 25% with a cap of 50 people. It means no standing room only options should be allowed, and that face coverings should be utilized in all industries for staff and customers. And again, one of the most cost-effective ways that we can keep our businesses open and our schools open and our hospitals operating is to the two simple things that require individual responsibility: physically distance and wearing masks. These are two things that are proven to help slow the spread. And again, we've said from the beginning we're going to follow the data, and the data right now shows that we are heading into a severe risk of hospital capacity constraints a couple weeks from now, unless things can change and change radically. So again, we are asking everyone in the state we're saying thank you to everybody who has been following guidelines. Thank you to everybody who's been physically distanced and practicing hand hygiene and avoiding opportunities for maskless transmission, whether that's in social gatherings in homes or whether that's in overcrowding in public or in bars. We thank everybody who's already gotten their flu shot. We thank everybody who's practicing their hand hygiene. And if you're someone who has, for whatever reason, has chosen to not participate yet in helping to slow the spread, we invite you to join those that are, and we invite you to join in particularly because of those strained healthcare workers that are working to try to save lives here in North Dakota, both for COVID and non-COVID hospitalizations. So with that, we know that there's a lot of stress going on. We know there's a lot of grieving going on in our state, and people could be grieving because of the loss of what they might call the normal activity, whether that's inability to gather the way people may have wanted to, or the inability for people to participate in activities in the kinds of close crowds that we're used to. That future will return. That will be back to us in the future. But for right now, to get through these critical times that we're in right now, it's important that we continue to take care of ourselves and our neighbors. We do that by following the guidelines, but we also need to take care of each other, not just physically, but also emotionally. And so feeling socially connected is more important than ever. And so during this time, make sure you're checking in with family, friends, neighbors who might be struggling with isolation, stress, anxiety, or loneliness, because you can be the difference in supporting them or being a helping voice. And you can also help another way, which is, again, we can connect people with free and confidential crisis counseling that's available to all at projectrenew.nd.gov. Again, projectrenew.nd.gov, or 701-223-1510 if people are particularly stressed right now for whatever reason. And then again, there are resources on staying connected, coping with anxiety, fear, and practicing gratitude. Those are all available at behavioralhealth.nd.gov/COVID-19. When we talk about gratitude, probably it's very easy for us to recognize that in 2 days' time on Wednesday will be Veterans Day, and it'll be a holiday for many, a national holiday, but we want to pause for a moment today to reflect with gratitude on the heroism and sacrifice those brave men and women have made, selflessly stood up for our nation and fought for the ideals of democracy in times of war and in times of peace. And our gratitude quote for the day comes from American physician and psychiatrist David Hawkins. Said, make a gift of your life and lift all by being kind, considerate, forgiving, and compassionate at all times and in all places and under all conditions. And be compassionate with everyone as well as with yourself. This is the greatest gift you can give anyone. In closing, I would just say to those of us in North Dakota, we have an opportunity to choose our future, and we can choose compassion. And part of that compassion, if you think about what compassion might mean helping, not just feeling compassionate for someone who is sick, but having compassion for someone who may be vulnerable and who the risk of illness could mean the risk of death for them. And so, let us choose with that compassion to be to support our healthcare workers, to support our loved ones, to support our elders, and to support our veterans, those that fought for us, that we can support all of those with compassion by following the guidelines that will help slow the spread. So with that, we'll stand for a few questions, and thanks for being here today. I'm going to go online first.
Tom Simon, Williston Trending Topics. Mayor Howard Klug ordered mandatory mask wearing today in the city of Williston. Can you comment on what you believe the effectiveness of this order will have on slowing the spread in Williston? And if there's science behind that, please cite it.
Well, we know masks work in slowing the spread, and I think there's certainly not conclusive data on statewide mask mandates, because in some of the states that have got rising infections and record infections have statewide mask mandates. What makes a difference is if the individuals choose to follow them. And I think that when we're talking about public health initiatives, when they come locally, again, I compliment and congratulate Mayor Klug, who's been a strong leader through all of this. That's the right place where it comes from, and we're seeing those pop up all over the state. When a local community decides that they're going to do it, then they can be doing it for each other. They can do it for their neighbor. They're doing it for their own healthcare capacity. They're doing it because they understand that it's one way that they can make a difference. So we support those, and we encourage them, and we stand behind those communities that are doing that, because we think it's a smart move. Okay, I'm going to go Amy.
Sure. So we will have a new president in January, and Biden said that he would work with governors on, issuing mask mandates, for example. Another thing that jumped out at me about his coronavirus response plan was that he would develop guidance for communities on reopening schools, businesses, things like that. You've made clear your stance on mask mandates. We have our own guidelines here. I guess, how do you envision working with the Biden administration on this?
Well, I think that one of the things that'll have to emerge and see with a change in administration is whether or not they are, what things are going to try to be done federally, what things are going to be done at the state level, and what things are done locally. And I think that there's a different view between parties and by people within those parties about when it makes sense for the feds to make a decision and when it makes the difference for feds should support states and when states should support local. And so we'll have to take a look at I wouldn't speculate about what actual things that they may or may not, do, but certainly as we have, I mean, the job elected as governor is to have the best relation possible with the federal government, regardless who's there. And we'll continue to fight for North Dakotans with the federal government, regardless of who's in Washington or who's in those cabinet seats. But I would again want to speculate, but we'll wait and see what those requirements might come, or what form of support. I mean, as I think, as you know from being here, we feel that the federal government has provided enormous support to the states. They've really delegated to the states, and whether that's been PPE or testing or the warp speed research dollars, the tens of billions of dollars that led to that very encouraging announcement this morning on a vaccine. I mean, all of those things are things that have been, from an unprecedented federally coordinated response, but delegated to the states for states to execute. Jeremy?
Governor, I just want to ask you about the amended health order today. You mentioned that the CDC had made some exceptions or some rules that would allow this sort of thing. I'm not an expert on this, but just some light Googling shows that their recommendations are for asymptomatic cases to wait 10 days before returning to work. I'm just wondering, can you help me reconcile that? Where are you learning the guidance that they have?
That one we'll just follow up with you after, and we can point you to it, Jeremy, where we're tying in with that. Can you point all of us to it? Yeah, we can point all of you to that. Yep, you bet. I'm going to go Morgan and then Jacob.
So my question is in regards to that rapid testing you were talking about. Can you explain a little bit, compare and contrast the testing we've been doing to that new rapid test, and then maybe explain the accuracy behind the rapid testing?
Yeah, happy to. North Dakota's not only done the most testing per capita, we've also done the highest quality testing per capita, because the highest quality testing is the PCR standard test, which is the polymerase chain reaction testing, which is done in the lab on a machine that can take hours to run. Those machines will take a sample. If they don't find any virus, they do a thermal cycle. They effectively replicate what's in there. There could be a fragment of the virus. They replicate it, and you keep doubling and doubling and doubling. And the CDC is now saying that if you've got a machine that does more than 33 cycles, so this is like to the 33rd power. I mean, so you're really taking something that is minute and recreating it, essentially creating a twin of it. Could be creating, literally billions of molecules that you're creating. That if you get beyond that, we might be detecting something that we call a positive test, that is somebody that might have had it 14 or 16 days ago and they're no longer contagious. And so we've got, again, a lot, we know with all the testing we're doing, but we also have done a lot of really high quality testing. Now we've got the new testing, particularly the Binax Now test. The Binax Now test is authorized and is really designed for catching people that have been exposed from 2 days ago to 7 days ago, and could actually be up to 10 days ago, but in that window when a person's got a higher viral load. So if you gave somebody who had been exposed 16 days ago a Binax Now test, they might come up negative, and if you give them a PCR test, they might come up positive, because the PCR test would keep expanding and expanding and expanding. Now, if we isolate the person who had the PCR test 16 days ago and is officially a positive, they may not be in the position to actually be causing any contagion for anyone else. The Binax Now test because they catch people with a higher viral load, may actually have, then they catch people with a high degree of accuracy within that window, then this is a new tool, because not only could we find out who the spreaders are right now, but we also find out in 15 minutes. We don't find out in 24 or 48 or 72 hours, or in some cases when we had issues with external labs out of state that we're shipping to. We had cases where sometimes people didn't get the results for 4 or 5 days. That was not helpful, not productive. So to having this new tool where it can help us identify those individuals that are spreading right now and know it immediately it's a game changer. And so we want to first deploy those, as I said, we want to deploy those to frontline healthcare workers to help keep healthcare workers, keep our healthcare capacity up. But then all the other pilots I described is something where we know that we're going to be able to potentially knock this thing down faster, because if you take that lag time out, even when we were doing the work in long-term care, when we've been testing everybody weekly since last spring, if it took 48 hours to get results back, either a healthcare worker was waiting 48 hours and couldn't work, or they kept working and then they go, oh, I was positive. We have a chance to really reduce spread if we can get people, infectious people out of circulation in 15 minutes versus multiple days. It's huge. So that's why we're excited about the new testing approach. I know I was going to go Jacob, but Dave, did you have a follow-up question, or is it?
First off, is having this new rapid test going to ease some of the pressure on the lab and some of the other labs? And as a follow-up, are we still having labs run at capacities 24/7, 365?
The answer is yes. We are still absolutely, the lab team still doing fantastic work, and they are still working 24 hours a day, 7 days a week. But this will take pressure off of them, and this is and again, I'm sure you'll see in some circles there may be debates where they'll say, oh, Binax Now is, quote, not as accurate as a PCR test. And the point is that if Binax Now catches someone that we wouldn't have been testing anyway, this is maybe for Lane or Jacob, a sports analogy, but you miss every shot you don't take, is wherever the phrase is. I mean, if we can get out there and start doing tens of thousands of Binax Now and possibly hundreds of thousands of Binax Now tests that wouldn't have been occurred, and some portion of those come back with people that have got a high amount of viral load, and we know it right away. I mean, those are all like, we've always said, hey, we're searching for the positives. So, because the way you beat this thing is find the positives and get those folks from stopping the spread. So this is like I said, it's a whole new game changer. The other thing is on cost. Binax Now was being offered as a $5 test. Federal government bought all those and they're giving them to the states, so they're free. Some of the other testing we're doing can be $125 a test at the state lab. So when the coronavirus relief funds run out under the current stimulus bill at the end of December, if we're in a position to do a majority of our testing with $5 or free testing, we could be doing all kinds of testing more cost effectively, and perhaps, if you will, using a different metaphor, getting more lead on the target, so to speak, because we'd be focusing our resources around contact tracing and around isolation around the people that are really infectious. So that is one of the bright hopes that helps us get to the vaccine. But obviously the vaccine news from today is also very positive, and why, again, when we asked North Dakotans to step up and help preserve healthcare capacity, we're not asking people to do this the rest of your lives. This could be something that we have to do here for a matter of months to bridge us to the point when we've got some more tools to help, particularly as it relates to slowing the mortality of this disease. Jacob?
Thank you, Barry. I'll give you extra credit if you make a NASCAR reference next time.
Okay.
I'd like to go back to the Biden-Harris COVID plan. Considering the role that North Dakota has played in a lot of pilot projects, I'm wondering what role you see the state playing in the transition team.
Well, I actually have been so busy focusing on both the budget, upcoming budget, and also the COVID that I hadn't really thought about that. But I would, I did give a keynote this morning to the IOGCC, the Interstate Oil and Gas Commission, where I've served as chairman for the last 2 years. This is the coalition of 23 states. One of the topics as part of that conference is federal-state relationships, because one of the areas where the state of North Dakota interfaces directly with the federal government is with Forest Service lands, Department of Interior, BLM, lands, Bureau, and Bureau of Reclamation lands, and as do the tribes, big interface between the tribes and the federal government, and then of course the EPA, and Administrator Wheeler, one of his folks was on presenting just before me today. I mean, these are all areas where it's going to be important, where North Dakota voice is heard in the new administration, because it's there's so many things in North Dakota that we do, whether it's in ag or in energy, or in UAS with the FAA. I mean, everything we do in many ways where we're trying to advance industries in North Dakota bump up against federal agencies. So it'll be important for us to continue to build new relationships going forward. Okay, I'm going to go to Lane and then back online.
Governor, now that the whole state is back to one singular color, do you plan on going back to a whole state approach, or are we going to continue going forward with a county by county approach?
I think we're going to stay with the whole state approach right now, because the thing that's really binding us together is not, it's not even, percent positives by county. It's not cases by county. It's the hospital capacity. We've got hospital capacity is a system across the whole state, and we're going to be working with the state and with all of those providers, the locals and the 6 majors, to make sure that we can optimize that. And that really affects every single county, because if you get sick in any county in North Dakota, and some of our counties don't have a hospital, you might go to the closest one, you go there, and then they're going to refer you to one of our majors. And if our majors can't take referrals, then we're starting to get into problems. And if they can't take referrals, it could be not because they don't have enough beds, they don't have enough staff. And they don't have enough staff because the staff have maybe contracted COVID, which goes back to, again, we got to stop community spread. So if you want to have hospital capacity available for non-COVID and COVID, then everybody's got a role to play across the entire state. So we are all in this thing together. And Chris Jones is here if anybody else wants to drill down. He was on all the calls with me last week and on the call this morning with the hospital leaders. Jeremy?
Governor, I'm just wondering, are you convinced that this health officer order, this amended order, will not lead to more infection if healthcare workers are working with COVID-19?
We're confident that it can, under the narrow restrictions that we have, which is it has to be in a licensed facility, it has to be working only with people that already have COVID, and they have to be asymptomatic, and then all of the PPE controls have to be in place. And so in those narrow scenarios, we think it'll work. We were asked by the hospitals in the state to take this action because apparently some of them had the ability to do this in other states, and they said that would be one of the ways for them to free up some capacity here. So we're, again, as part of our collaboration with the hospitals, we're making that step. I'm going to go Amy and then online, and then Jacob.
On that note, do you have any sort of numbers or percentages in terms of how many hospital workers do you think that this will ultimately allow to return to work at a given point in time?
That'd be a good question for us to circle back at the stand-up tomorrow morning and ask that question. But I think there's no silver bullets when you're trying to enhance staffing, and that's why today you saw us do multiple things. One was the amended state health officer order. 2 was with the EMS, because if that can free up EMS for doing statewide specimen test collecting, that can move our pool of nurses at Department of Health into supporting the hospitals more directly. The rapid testing that we're going to be deploying will help get. There could actually be a bigger impact, because there may be more people on the sidelines waiting for test results than there were people that couldn't work because they were asymptomatic positives. That could be a larger group, and at least to give you at least a rough scale, we'll get some more numbers. But in one of the conversations, one of the one-on-one conversations I had with one of the major leaders, they said they would have in recent days they could have had 18 more beds available if they could have been getting tests back sooner, because people were just on the sideline. They were close contacts, they were waiting for results. And whether that means 2 to 3 people per bed, but it gives you an order of magnitude that we can make a difference here. Okay, Danny, online.
Jean Shemp, Hometown Radio Group. Looking at the state health metrics that determine risk levels for counties, several counties are or have been in the critical risk level for quite some time. Ward, Grand Forks, and Cass are all in the red for test positivity and active cases. North Dakota, the state as a whole, is also in the red for test positivity. Why haven't any counties moved into the red, and will you ever move any or all of North Dakota into the red?
The answer to the second question, Gene, is, or maybe there's a third question, there's multiple questions there, but is that, yeah, we reserve the sort of the use of all the tools that are available to us to help protect the health and safety of North Dakotans. Last spring, we obviously, when we didn't have this color code, we essentially went to critical very quickly with the restriction and shutting down of businesses across the state. We now know that that shutting down the economy doesn't necessarily slow the spread, but the things that we've talked about, hand hygiene, masking when you can't physically distance, and reducing group sizes is what slows down the spread. So again, we're trying to find an approach where we can keep businesses open and services moving for the citizens of our state, and our schools open as well, and at the same time slowing the spread and preserving the hospital capacity. So that's where we're going. If we move to the critical, the fifth stage on that is under the guidelines involve business closures, and in some cases the way those guidelines are written right now, like closing personal care businesses, we don't think personal care businesses where both the provider and the client are wearing masks represent high risk of transmission. There's no indication that that's where our issues are, and so we're again, as we continue to learn as we go, we're trying to do the things in a targeted way that have the most effect on reducing the transmissible moments and have the most effect on preserving healthcare capacity and the least negative impact on the citizens of our state in terms of causing loss of jobs or hurting business owners. So that's what we're trying to balance. Okay. I think it's Lane, and then
Chris Jones.
Okay, thank you.
Chris, we've been hearing a lot about the hospital capacity today, but I was also curious if long-term care is also on that same trend line as hospitals going upwards, or if it's balanced, or what's going on there.
Yeah, thanks. The trend line for long-term care is the same, and so when we look at the state health officer amended order, that also will assist in long-term care. But to the governor's points earlier, it will require for them to change the way they do things. So it's not just like they can now have asymptomatic healthcare workers come in. Those asymptomatic healthcare workers can only work in COVID units, can only enter the building in one way, not with their other coworkers. So they are completely isolated from the non-COVID positive healthcare workers. So we are under a significant amount of stress for healthcare workers in long-term care as well.
I have a question for you, Chris. Going off of that similar note, can you describe the survive versus thrive that this order could help with? Is it still going to be pretty stressful in there, or is this supposed to make things a bit more relaxed?
Well, I definitely wouldn't say it's going to make it more relaxed. I think, in some respects, this is, we are using, as the governor said, the tools that we have. Again, to what was mentioned earlier, many states have already used this CDC guidance in order to best use workforce. So out of an abundance of caution early on, North Dakota did not. And so now we feel like to measure the risk against having a COVID positive healthcare worker work in a COVID positive unit far exceeds the risk of not actually having healthcare staff, not only in long-term care, but also in other healthcare settings.
Do you know how many of our state's long-term care facilities have COVID wings or COVID units?
Off the top of my head, I do not, but we could get that for you.
This would be for you or the governor. It's a question about the EMS personnel. This should be a quick one. money that would be used to hire EMS personnel, where would that money come from? Would that be CARES Act money? And then is there a total number of EMS personnel that you'd hope to be able to hire?
The first answer is yes, and the second answer is I don't know, but we can get you the answer on how many they're trying to hire. And then I'm going to do one online, and then we're going to wrap up. But before I wrap up, I do want to say Mike has just shared that the link to the CDC website that Jeremy was asking about has been, I think, sent around to everybody. So you should have that related to that order.
Kolpak with the AP in Fargo. Are you able to tell yet whether some of these cities that have asked for masks to be worn everywhere, that mandate is, if that mandate is working?
We have, we're not seeing in the numbers yet, because obviously that some of these that put in these mandates a week or more ago, 2 weeks ago, are still seeing their numbers rise. But from the mayor's calls that we're having, they're indicating that there's increased participation, and I think particularly where they saw it was in the business community, because there's something, it's probably human psychology. It doesn't matter what the activity is. If you're the only person in a room doing it and everybody else is doing something else, it always feels a little awkward. But if everybody else is doing it, it's pretty, and you're the only one that's not, it's pretty easy to say, hey, I better go with the majority. That's kind of a human nature thing. I think that in the business community, people had concerns that if they tried to enforce some kind of mask usage within their business and put that pressure on their own employees or on themselves, that they might offend customers. When they can put a sign up in the door that says, hey, everybody's required to wear a mask because it's ordered by the city commission, by the county commission, by the mayor, that some of those signs went up relatively quickly, and we did have the mayor's report that there were businesses that had no mask policy for customers, employees immediately flipped and did have that. And so those are some positive signs. And again, all this is incremental all helps. It's like we don't have to get to 100% participation to start making a difference. Just more of all the good things. More physical distancing, more masking when you can't physical distancing, more businesses participating, more people having compassion about their neighbors and the healthcare workers. All that works. And I would think that right now with this is, again, I would highlight back to the part of the reason why we're here today is because this idea that it took us over 200 days to get to 5,000 cases, and it took us less than 21 to get to 10,000. I mean, that ought to be the math lesson for everyone, is that we're in this point of exponential growth, and a significant portion of those are over age 65. They're going to need care, and the other 80% of our healthcare capacity is going towards very important things, that are always happening: cancer, heart, stroke, emergency services, all of that stuff. And so again, we've got an opportunity here as a state to step up and be compassionate about our neighbors and help our healthcare providers. And so again, while these are in the all orange and these are guidelines, we think that people take a look at the guidelines, take them super seriously, and say, hey, if I'm following the guidelines, I'm really being a patriot. I'm helping protect veterans. I'm helping protect our community. I'm helping protect our state. Let's do this in a way where we know that because we know that everybody's individual effort's going to make a difference. So with that, thanks for being here on short notice. Thanks for helping get the word out to everybody in the state. And again, thanks for the important role that all of you play.